Of course, the most exciting is the progress in anti-aging area through the genomics applications. But there is another aspect which we cannot forget and which is extremely important, and it's the evidence-based medicine. So we will discuss first what is the real face of genetics today and the main international strategies in this field, how evidence-based medicine can influence this field, and what are the frequent mistakes of understanding of genomics between doctors, scientists, unfortunately, and also, of course, our patients. We will talk about genetics of interactions, also known as the new genetics. Sometimes we also use the term of functional genomics, of epigenetics. You see, there are a lot of terms, but the sense stays the same. But what is the most actually vital, that genetics of interactions is the basis of personalized prevention and treatment, and as a consequence of it, of course, can be applied in anti-aging. And the first tool publicly available, officially publicly available, and I can say it only now because these are the news after this summer, that nutrigenomics is the first actually strategy which can be definitely applied for longevity and aging, and especially, of course, anti-aging in our case. And I will be really happy today to present to you the new look and the perspectives which are opened in front of anti-aging medicine through the huge breakthrough which have been done this year, especially this year, in genetics of aging and gerontology development. So, and of course, and it's extremely necessary, I will demonstrate to you at the end the main principles of real personalized programs development based on genetics for preventions and their practical applications. So let's start from the beginning. So as you know, about several years ago, nobody knew about the huge progress in genomics, and indeed the Human Genome Project has been finalized in 2003. So, and it can be compared with the knowledge of the alphabet. So we know what are our genes, we know how many genes we have. And now the question is how they function, what they do. By the way, do you know the number of genes which we have? How many? Yeah, well, we are just a bit less, but not far. So it's about 30,000 genes that we have now. And of course, it's extremely exciting. So, but moreover, the post-genomic era, what means application of our genetics knowledge in everyday life, has been officially declared nearly 7 years ago, when he learned only about 80% of our genome. So now, the first one of the other good news of today, I congratulate you, because it's already nearly 7 years when we live in post-genomic era, what means application of genetic knowledge in our everyday life. So now, let us clarify it. What does it mean? So, officially, genetics is developed, of course, very quickly, and is divided into 3 main groups, main international strategies. The first one is called genetics for medicine. That's all what you've heard about genetics up to now, and what your patients know about it. And what they know, it's very sometimes sad and difficult to change, because the first impression when we say genetics, and the first idea, of course, it's inherited diseases and fatal consequences. And when we talk about genomics now, very often your patients would tell you, I don't know from what I'm going to die. And I don't want to know my genes or whatever. But the good news are that only about 10% of our genes are involved in severe mutations. Which provoke inherited diseases. And if we talk about the most frequent inherited diseases, we can count only about 120. That's all. But fortunately, more than 90% of our genome functions in the other way, and our genes are somehow our friends. They accompany us every day, every moment in our life. When you eat, when you drink, when you fall in love, when you listen to the presentations about genomics, when I ask you questions, you just go like, what she's doing. So this is the other area which is called genetics for health. That's what we are doing. That's what actually what you can do with your patients today. It's very positive and it's very somehow it contributes a lot to health improvement, and I will demonstrate you now how. So we work at the area which is called genetics for health and personalized prevention, and not genetics for medicine, what corresponds to severe inherited disorders, and we leave it, please leave it to genetic specific centers and prenatal diagnostics, of course, gene therapy, that's there. And the third strategy which we apply, which we are doing actually now, right now with you, it's genetics for society. It's all what concerns education of doctors, of patients, and the formation of specialists, which is extremely vital. So at our institute, we have quite unique experience through the development of genetics for health. This strategy and activities are presented by education, first of all, for physicians, which we form doctors since already 7 years, together with state universities in France, Paris, Nancy, Clermont-Ferrand, and it's a state university diploma. So we do the same also in other European countries now, listed below, and Russia, and we have also some development of collaboration since this year with the United States. So the second aspect concerns expertise development, because education of doctors, that's the one story. The second is how to apply genetics for everyday use. And of course, it's not the role of the doctors to perform the genetic expertise. The role of the doctors is to apply correctly recommendations based on genetic profiles. And this is quite a tricky thing, because it's the doctors who should assume the follow-up and the continuation. And please remember that genetic profile we do only once in our life. So it's somehow the idea of it, and it's very exciting and very important moment in the life of the people, of your patients, because it's the story about meeting yourself. So they just take they become conscious about their genes and the structure of their genes, about how they function, what is their potential. And the story is to live in harmony with the genes and not to take it like a contradiction or like the enemies. So it's very important. And all these communication strategies with patients and with doctors we develop together with psychologists in different countries, and we have special lectures only on communications with patients and doctors, how to present things, how to present the results. I wouldn't talk a lot now about it. I would just only highlight the importance of this point, which is crucial, because you can traumatize a lot the patients, and I know such cases, unfortunately, when the patient followed, it's a real story, 10 years of psychoanalysis after incorrect genetic result presentation. So you should be really careful. Okay, so this somehow their main strategies, main activities, and now I'm really very somehow I find this slide extremely important, because this is all the experience which we have, which can allow us to say what are the most frequent mistakes between doctors and patients of understanding of genomics. And it's